Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about error prevention by bedside check. And I'm privileged to welcome our expertise, Dr. Hepsi Charles, the principal from Paavai College of Nursing and Research, Namakkal and District Tamilnadu. I welcome you, ma'am.
Thank you very much. Thanks for the wonderful opportunity. A very pleasant afternoon to one and all.
Thank you, ma'am. And I would like to extend my warm welcome for my beloved speakers who are none other are bedside learners. Ms. Swapna, who is our senior nursing officer from Niloufer Hospital, Hyderabad. I welcome you, Swapna.
Good afternoon, ma'am. For this wonderful opportunity. Good afternoon, all.
Thank you. And without fear, I can see Miss Krishna Nandana, who is our only student nurse from second year from Yashoda College of Nursing, Secunderabad. I welcome you, Krishna.
Thank you so much, ma'am, for entrusting me with this valuable opportunity. Thank you, ma'am. Good afternoon,
Thank you.
everyone.
Thanks. And we're just going to keep this session very time bound. Yes. And going forward, as our topic is why bedside checks matter. So the first insight we would like to understand from Dr. Hepsi, ma'am, like why bedside check matter for bedside nurses, ma'am. Over to you.
Bedside checks are crucial because they significantly confirms patient's details. It ensures patient safety, professional accountability, and overall, it helps to provide a comprehensive quality care. So as we see, patient's details are very important when we go and check in the bedside. The patient's general condition, his vital signs, his safety. So by taking care of this, we come to know that patient is very safe and provided a good care. And reducing medical errors, thereby patient receives a quality care. So there is always a chance for patients to receive, the nurses to go into some sort of error like medication error, and even interpreting the laboratory values. Like suppose if the patient's blood sugar value is being misinterpreted, patient might get again insulin dose and it can lead to a lot of chaos. Patient may go into hypoglycemia. So this could be avoided by checking properly. Patient receives the right care and treatment. So patient safety can be improved with this, especially the vital signs. We can even monitor on the cardiac monitor whether the patient is going into bradycardia or a tachycardia, and it can be recognized quickly and the action can be taken. So that's why bedside checks are very, very important for nurses to provide a quality care, as we all have studied from the colleges and as we have practiced our profession as a bedside nurse.
Yes. So, very practical tips you have provided why bedside check matters for bedside nurses. Yes, going forward, we like to understand from Swapna at your setup what's happening. Let us also understand like what is bedside check means for nurses. Like you all are practicing bedside, you take care of your patients. So, what is your insight on the same? Swapna, over to you.
Yes, ma'am. Bedside check is very much important and it's a simple task where nurses can verify and confirm. Not only case sheet handover, it also includes complete assessment of a patient condition. It also includes critical information like anticipating emergency services and also medication stock and accuracy. What are all medications we administer to the patient that are very much important to check before administering. Also check consumable correctness and equipment functionalities like oxygens, monitors, pulse oximeters. These are all important.
So, do you think the nurses really checks this? And if at all, let's say if at all you're taking the patient on your third day of your patient care, how long it does take to just check the bedside inventory or consumables or patient condition? How long it will take? It is more than 3 minutes,
It takes
5
only
minutes?
2 minutes of time, ma'am.
Yes.
It
Yeah,
takes
I
only 2
appreciate.
minutes of time
Yeah.
to check.
Yeah, going forward again, we'd like to understand from our student Krishna, like as Swapna was quoting, like critical information, like anticipating or identifying early warning sign. Like yes, Krishna, would you like to say something here? Yes, over to you.
Ma'am, as the name suggests, that critical means it needs that immediate attention or immediate assistance. So by this critical information, it means like early warning signs like lower saturations.
Yes,
If the hemoglobin levels drops below the normal value, we should communicate it to the authorities as soon as possible. Don't delay it. That what
yes.
means. Critical information means.
Yes, that's how we try to, tell the nurses always learn the normal range and critical information, and which should be always communicated with the clinical team. Yes, very beautifully you have said. Yes, going forward, does skipping? I know this things has to be, practiced, but again, my insight for Dr. Hepsi ma'am, does skipping bedside checks risk neglecting care or treatment?
Yeah,
Yes, over to you, ma'am.
definitely.
Yes,
Yeah, definitely. Skipping bedside checks risks neglecting care because few aspects of care or treatment may be neglected. For example, pressure mattress help.
yes,
All of us know that mattress help prevent pressure sores. But if
yes.
it's not working when you are taking over, you are supposed to check it. So patient will definitely go into a pressure sore, and patient might have some complications due to this. So it's always better that we check whether it is working in a working condition or not. And you have to be prepared for that. You just check whether there's
Yes,
any redness on the patient, whether the patient has started developing pressure sore already or not. And again,
yes.
position, what position patient is in, and the position change, all that it's necessary. Then
Mm,
disposable
mm.
syringes not discarded in the bin. So suppose
Yes,
we might see even the disposable syringes lying on the bed of the patient, which might cause injury to the patient and it may harm the patient. So we'll have to
yes,
clear all the bed linen, wet linen, wrinkled bed. All this can give rise to a pressure sore. So all this we are supposed to check and monitor this. And again, morning dosage of oral medication not taken by the patient. So a nurse should ensure that the patient takes the medicine and then only she should leave the bedside. Sometimes patient takes the medicine and keep it under the pillow, or he may leave it
yes,
on the locker, leading to lot of jeopardy. Maybe it's an antituberculin drug which he is supposed to take it in empty stomach. So a nurse should check the bedside to prevent all this. So by doing this, we can definitely be sure that bedside checks will not risk neglecting or care. But if you don't skip, if you do skip, it will definitely lead to a lot of problems. So we should not skip
yes.
the bedside checks.
Well, we have tried giving a lot of examples. Yes, I request all the viewers, these examples are real-time experiences and, patients' inconvenience. So kindly adhere to this. Yes, as Dr. Hepsi said, these are very important for the quick and short bedside check. Yes. Going forward, now, the insight from Swapna, we like to understand, Swapna, is it crucial to complete these checks in short before handover? As you were saying, it takes only average to maximum of 2 to 5 minutes
Two
of
to five
time to check.
minutes.
If it depends on nurse-patient ratio as well, or the patient, if the patient is in ICU, again the scenario changes, right? So, what do you think? Is this crucial to complete these checks before your handover?
Yes, ma'am, it is definitely important. Irrespective of any time, it is very much important. And the short checks ensure everything is in order. Patient medications are correctly procured, reports are placed for doctor's review in time. Also, missing ID bands. If at all the ID bands are missed, then a nurse should check and reapply the patient bands. It does not take two to
Yes,
five minutes, ma'am. It's a
yes.
very short period of time.
Yes. So what do you have to say, Krishna? As Swapna has rightly said, these checks are very important. Do you think these checks are important because you are now a student? Whenever you go to clinicals, you also take the privilege of checking what's happening, with the bedside and not only bedside, including patients. Yeah, over to you. What is your insight on this?
Yes, ma'am. As Miss Swapna ma'am has told that it's crucial to complete this step because it's important to avoid the life-threatening conditions as well as it is important to ensure the patient's safety as also it is to ensure the accuracy of the information passed in between the handovers. I think
Yes.
it's really important to complete these checks, ma'am.
Yes, and it not only patient, even nurses are safe. Medicos, healthcare professionals, whenever they do these checks, as Swapna rightly said, Dr. Hepsi ma'am tried to saying that, pressure matters not working, equipments are not working, that, this we can always sort it out. Yes. Going forward, why bedside checks are sometimes not done or overlooked? Krishna, we like to understand from you first. And yes, why? Could be the reasons? What you think these things are not done? Yeah. Or maybe, yeah.
Ma'am, mainly the thing is that believing the errors won't happen again. It's an overconfidence or over reliance is mostly the problem. Otherwise, the routine board task, like that routine nature or repetitive nature, make a discredited mentality among the nurses.
Yes.
So it might be the reason why the bedside checks are sometimes overlooked.
Yes. In general, we are trying to say sometimes, as Krishna said, believing that errors won't happen, or we assume. Yes. Furthermore, what is your opinion, Dr. Hepzibah? Like,
Yeah,
what do you think? Why these are not done? Sometimes we do
yeah,
have time, but then these checks are not done. Yes.
yeah. Assuming everything is in order or available, it should not be done. You
Yes.
confirm. We should not assume. We should not
Yes.
do anything on assumption. So everything should be checked, especially when the patient is on intravenous infusion, for example. So what is the next point to be connected for the patient?
Yes.
Maybe patients, whether patient has got an IV plan, what is to be connected next? Is it available? Or it might be an antibiotic to save the patient's life. Is it available on the bedside? And what is the dose
Yes.
of it? Is it sufficient? All this a nurse must check prior before you start handing over, because
Yes.
you don't need to run around at that particular moment and wasting the time. So you can conserve the
Exactly.
time and also the patient's safety. So it's very important. I can say about 3S. That is, first you stop, then you do scan, then save. Scanning means checking all that. So
Yes.
you remember these three mnemonics: stop, save, scan, and save, so that you can save the patient's life. And you have to be sure also that it's a human nature to err, but it's a patient's life that we are responsible. We're accountable for our profession. We're all
Yes.
professionals, so we are accountable. So you'll have to check all this and see. When you do this, definitely the bedside checks can help us, and assuming can be avoided by the nurse.
Yes, yes, very, your productive insight has been thoughtful, yes. And yes, we also like to understand what errors at bedside can be seen if bedside checks are not done. I think, yes, bedside learners and bedside nurses. I mean, yeah, Swapna, you have great years of experience. Can you just take us through, for this insight? Yeah.
Yes, ma'am. Sometimes some possible errors may happen if checks are not done properly.
Yeah.
Maybe medication errors. For example, right medication on right time with the right dose is important. So we need to
Yes.
check what is prescribed, and according to the prescription, the orders to be followed by a nurse. For
Yeah.
example, if a doctor prescribed 1.5 grams to a particular patient, that is cephalosporin injection, sometimes in market we get 3 grams of injections. So nurse should have a major knowledge how to dilute an injection and how to administer right way. So that is
Yes.
one of the thing. Lab results not collected. Sometimes we also miss the reports may doctor may collect. So we should also take a authority to check the results. If it is not collected, we should collect on time. And we should check a patient falls or other safety incidents also. These are
Also, I
main
think,
important.
yes, very importantly, you said yes. Also, I think by doing this, check patient who is not convinced, they will, rightly connect with you because you're communicating, you're assessing the patient condition,
Yes.
during, before your handover. This gives a lot of trust and communication, and it will sort a lot of communication
Yes.
issues. I think, yes, Krishna, what is your
Yes, ma'am.
insight? Yes, we can connect with the patient more better, right?
Yes, ma'am.
Yes. Yeah. So going forward, this is, uh, should these bedside checks be performed continuously before taking patient handover every shift? Yes, we do follow 3 to 4 shifts, and but this glance of eye detail checks, should it be done before every shift? Yes. Over to you, Dr. Epsi ma'am, for your
Yeah.
insight.
Yeah. Bedside checks are very, very essential, and it's before every shift, it has to be checked because we'll have to know the progress of the patient, whether
Yes,
progress of the patient is continued or the patient is deteriorating, and in which shift it is gone, what has happened in the previous shift, whether the patient's condition is deteriorated, whether it was documented, any action was taken or not. So because the patient doesn't die all on a sudden, patient goes
yes,
through certain signs and symptoms. So unless we notice it each shift, we cannot come to a conclusion that patient has gone all on a sudden. So
yes,
unnecessary, in order to prevent the blame and errors, it's nice to monitor each and every time, and you check the date, time, document everything, inform the person to be informed, like doctors, that the patient is going into a bradycardia, what has to be done, and document it. So immediately after you receive the order, you go do it, and then we can save the patient's life. So early
yes,
intervention is very essential. For that, we'll have to definitely check the bedside checks. So
yes,
you have to know that we are responsible for the patient's life and safety. So by doing this bedside checks in each and every before every shift, we can prevent unnecessary complications, and we can prevent disasters.
yes, yes. A very thoughtful insight, as generally what happens in the scenario you have, provided to us. Yeah. Let me also understand from Krishna, what do you think? Should this text to be done before handover? Krishna, yes.
Yes, ma'am. In my point of view, also it's important to ensure the continuity of care as well as the patient safety. We as a nurse should ensure that not only the patient's case sheet is being taken over, but the
Yes.
current stable condition of the patient is being taken over as well.
Yes, yes, very nicely you have told. Yes,
Yes.
yeah, I think the time is not enough for us, because this is a very broad topic, and yes, we have to see whether we match the criteria for the time. Yes, does the manual method of checking reduce medical errors? Nowadays we see a lot of technology and sophisticated barcoding system we have in the hospitals, and especially in the tertiary care centers. Yes. So, over to you, Sapna. Like, what is your thing? Manual checks, do you like manual methods of checking, or you just completely rely on the technology? Yes.
Yes, my manual checks are very much important. And manual checks can also help reducing errors, ensuring or cross-checking before administering any medication, mainly high-risk medications or any task we do for the patient. Everything before we go to the bedside, we need to check and ensure the labeling of the medication. We need to read twice and expiry of the medication. And for our rechecking, we can also give it to our co-colleagues to check, verify,
Yes.
and then before administering we should go check and do everything, ma'am. Not only medical errors, sometimes we also leave all the gloves, syringes, everything in near
Yes.
bedside.
Yes.
So we should also look after the patient safety as well.
Safety and yeah, unit as well. Yes. Krishna, what is your thought on this? Whether does the manual method of checking reduce medical errors? Like,
Yes, ma'am. Mostly it reduces the manual method rather than the technological approach will reduce the medical errors mostly.
yes, yes, very nicely you have provided. Yes, these things are supposed to be followed. Yes, Dr. Hepsi, ma'am, like, what is your thought on the same?
Yeah, manual checks can help us to reduce errors, no? Because, like suppose for example, giving administering narcotics, it's
Yes.
always the policy is a double check. So a person who administers should always check with other person as a colleague to check everything pertaining to the orders. What is the dosage given? Whether the drug is expired, and what is being administered. It's always nice to do a cross check before administering. And even
Yes.
emergency drugs, like suppose for example xylocard and xylocaine. Xylocard is an anti-arrhythmic drugs, and xylocaine is a local anesthetic drug. So both the pronunciation is almost the similar. So nurses working in emergency room, it has happened once when I was working abroad. This patient, instead of given xylocaine, the patient was given xylocard. Xylocard
Yes.
reduces, increases the BP and reduces the heart rate. Patient went
Yes.
into a bradycardia and patient's life was put at risk. So these are the very essential checks that we do. we do check all this, and then to be providing a safe patient care and quality care, definitely the medical errors can be avoided by doing manual method of checking.
Yes, so certainly the SOP on look-alike and sound-alike drugs, which should be kept apart, and the label should be done so that nurses also recognize before they take the medications and dilute and administer it to the patient. Yes. Yes, this was a very valuable discussion. I think, yeah, the time is not enough, and yes, we are going to end the session. I thank Dr. Hepsi and Krishna and Swapna for your contribution for this webinar. Yeah, I thank you so much for this valuable session.
Yeah, I
Thank you
personally
so
thank
much,
the
ma'am.
management of Yashoda Group of Hospitals for giving me this wonderful opportunity, and to Mrs. Shanti, who was coordinated very well. Thank you for all the support. Thank you very much.
Thank you,
Thank you so
Swapna,
much, ma'am.
and
Thank you for the Yashoda Hospital group that they remembered me and they given this
yes,
wonderful opportunity. And thank you so much, Shanti ma'am, for your
thank you.
cooperation.
Thank you.
Yes.
Thank you
Thanks,
so
Krishna.
much, ma'am. Thank you so
Thank
much,
you.
ma'am, for entrusting me with this opportunity. Thank you so much, ma'am.
All
Thank
the
you.
best.
And we end the session.
Thank you.
Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am. Thank you.